Oops.
Okay, I'm ready.
Okay, so if you've read and understood considering it surgical and augmentation, please begin and kindly identify what are you looking at.
I'm looking to cranial fossa,
Okay,
middle
which view?
and anterior and posterior cranial fossa.
Which view?
It is coronal view.
Okay, right. Maybe you can call it. Okay, all right, if you want to call it that way. Right, these are a group of three cranial fossae, anterior,
Yes.
middle, and posterior. Can you tell me the boundaries of middle cranial fossa, please?
Middle cranial fossa boundary is anterior by lesser wing of the sphenoid bone, also by the anterior clinoid process and part of the uh, sella turcica wall.
What are the content
And
of, yes, middle cranial fossa?
it is temporal and parietal lobe of the brain.
No, just temporal lobe.
Temporal,
Contents,
temporal.
yes.
Okay.
Okay. Can you identify trigeminal impression?
Trigeminal impression. It is near 44. 44. Number
Okay,
44 here.
right. Okay, can you tell me, right, if you could identify, wait, I want you to answer 42, what that is, please.
42 is anterior. Uh, it is ophthalmic fissure, superior ophthalmic fissure,
Superior orbital fissure.
superior orbital fissure.
Okay, right. If you could identify on the other side, if you could identify 13, please.
Here is uh, rotundum or
Yes,
foramen rotundum.
foramen rotundum. What are the structures which pass through it?
Rotundum, maxillary division of the trigeminal nerve,
And
and emissary vein, I think, is with it. Rotundum mainly the maxillary division of the
maxillary
trigeminal nerve.
division of trigeminal, yes,
Yeah.
only. If you could also identify number 12 here,
12 is foramen oval.
ovale. Okay, what passes through it, please?
Oval, otic ganglia, and mandibular division of trigeminal nerve,
Okay.
and lesser petrosal vessel, and accessory vessel of the meninges, and uh, measure
14, please. Identify it, please.
foramen spinosum,
37, please.
vitreous part uh,
Temporal
of
bone.
temporal bone.
Right. If you could identify, right, there are two more things, three more you have to identify. Number one here.
Anterior clinoid process,
Yes, and 32, please.
lesser wing of the sphenoid bone.
Please identify number eight.
8, dorsal part of the sella turcica.
What is four, please?
Clevius.
Define it. What is clevis?
Clevius is a fusion of the sphenoid bone with occipital bone.
Okay. If you could identify number 11 here.
Foramen magnum.
What passes through foramen magnum?
Foramen magnum contain anterior and posterior spinal vein, vessel, and vertebral artery right and left, and also it contain the lower part of the medulla oblongata, and also accessory nerve, and tentorium, and part of dura, part of dural fold, and ligament of dense ligament of the atlas
Okay.
vertebra.
Please identify the last thing, structure 30.
Jugular foramen.
All right. Okay. Moving on. Please identify this circled structure 29.
This is a pterion.
Pterion, please tell me what are the bones which form pterion?
Pterion is formed by frontal bone, parietal bone, temporal bone, and sphenoid bone.
What is the clinical significance of pterion?
Behind this bone, running the middle meningeal vessel, in which any injury to this vessel could lead to epidural hemorrhage.
Please identify 32.
This is a styloid process of the temporal bone.
Please tell me what are the attachments of styloid?
Stylohyoid bone and styloglossus and stylo pharyngeal muscle.
There are 3 other things as well.
It is
Stylohyoid
three
ligament,
three things.
stylopharyngeus, and stylohyoid and styloglossus.
Okay.
Okay. Right. Please tell me what are the causes? Okay. If you'll come across an image which shows lytic lesions of skull, what would be the causes that you'll think of?
Could be metastasis to the skull.
Yes,
Could be multiple myeloma. Could
yes,
be sarcoidosis.
yes,
Uh, could be Paget disease
yes. Osteomyelitis or
and
even
osteomyelitis.
angioma.
Yeah.
Okay, please tell me. Right, if you could tell me where exactly, right. What I want you to tell me, if you could identify, you can't see here. In the previous image, if you could tell me
Mm-hmm.
where exactly would you find sinus dural venous sinuses?
Okay. At first, the transverse occipital sinus at 23,
Yes.
and also the superior and inferior sphenoidal petrosal sinuses around the 20, and and the other one is near 27, like this, the
Okay.
sphenoidal. Also the uh, influence vein at 29. Also the cavernous sinuses on the lateral side of the sphenoid sella turcica, and also sigmoid and straight sinus uh, is not cannot be seen in the
No.
bone. It's running
No.
on the, yeah.
Okay.
Uh,
One last question. This was Clevis. If you could tell me which bones or the structures in childhood form the clevis?
it is a fusion between the sphenoid bone and the occipital bone.
Very good. Okay. Can you name few tumors which are benign and found in the posterior cranial fossa?
Even daimoma, schwannoma, and
Medulloblastoma.
medulloblastoma.
Good. Thank you.